At least 6 doctors in Saskatchewan and 1 other clinic staffer are facing disciplinary action after allegations they snooped into the medical files of the Humboldt Broncos bus crash victims. Let's go to Megan Roberts, who's on that story. Now, Megan, this has been prompted by an investigation by the province's privacy commissioner. What has that revealed?
It did reveal, that investigation, that there was some access to some of these files that was deemed inappropriate, that shouldn't have been done. So this was such a high-profile case that there was concern that exactly what would happen happened. There was concern that somebody would go looking into the medical files of the people involved in this crash. So eHealth Saskatchewan, which collects and manages the electronic health records of people in Saskatchewan, actually set up essentially an alert. It put the victims of the crash on a watch list so it could monitor who was accessing their files and their information. And they did find that some people were accessing it that perhaps shouldn't have, according to the privacy commissioner. They gave a couple of examples. There were 3 doctors who had treated victims right after the crash. The victims were then sent to Saskatoon. After the victims were sent to Saskatoon, these doctors then accessed their files again to check on them. And the doctors say that they believe they were still within the circle of care for the victims of the crash. The privacy commissioner says that that's not the case. The doctors actually violated the need-to-know principle, which states that staff should only be collecting, using, or disclosing information necessary for the diagnosis, treatment, or care immediately of an individual. So they say that under these circumstances, the need-to-know principle was violated. eHealth also said that principle was violated by a doctor in Humboldt who checked on the files of 2 of their patients to see whether or not their patients were injured or deceased, killed in that crash. Again, not strictly on a need-to-know basis, according to the commissioner. Finally, an example was an employee of a medical clinic who was investigated. This person accessed the files of crash survivors to confirm information that they were told by family and that they saw on the media. That person ended up eventually leaving their job. So after all this, the privacy commissioner recommended having privacy training and monthly audits so that people better understood when and how they're supposed to access this kind of information, especially in such a high-profile case, Heather.
Megan, thank you very much.